I'd like to introduce everybody to today's speaker, Dr. Mary Kay Chess. She is leading us through all of the Learning Community webinars, and she is the Director of Educational Programs for NCHN, the National Cooperative of Health Networks Association. She is also Dean of Academic Affairs at Pinchot University in Seattle, Washington. She teaches systems thinking and complexity, adaptive change strategies and leadership, and personal development. She also consults with foundations and organizations as well as their boards on building the leadership capacity necessary for thriving in our complex world. In addition, she serves as a leadership coach to executives and faculty teaching teams. So I'll turn it over to Mary Kay now to share her presentation. And it's *2 to unmute, Mary Kay.
Leslie, can you hear me? I had unmuted before. Is it still holding?
I can hear you now.
Okay, perfect. Welcome, everyone. Leslie and I are delighted that so many of you have joined us this afternoon. And before we start, we actually had a session right before yours, and I want to give you some feedback on how your colleagues are looking at change. They also took the survey, and most of them landed on change is healthy. So we'll keep tracking this throughout the day, and it's not surprising. There's a whole range of how we react to change, and sometimes it has to do with the time of day and the time of week and the situations facing us. So the fact that change is highly variable is just being demonstrated by your great learning community. So welcome. We are going to dive into change, and just to take you back, those of you who were with us the first session that we had in the learning community, we really spent some time on innovation and creativity. And so today we're going to build on that, and we're going to take you into looking at, so what does change leadership mean? How do you manage and can you manage change? That's really a great debate in business circles, and most of the research is landing on the fact that no, we can't manage change, but we can put in place structures that allow us to make choices to lead successfully through change. So we'll just explore that. It's a wonderful conundrum to unfold. Then we're going to look at some actual tools, and then as Leslie said, please pull out, if you don't have it yet, your actual assessment so that you have it with you. We hope that these sessions are very focused on you and your leadership and the growth and sustainability of your network, and also to meet the demands of your deliverables. So we're going to go through and be able to pull out sections of that. So as we move through, let's first start with something that we believe is a key change tool and a key tool for sustainability of your network, and that is for every board meeting and or every steering committee meeting, every staff meeting, and every community meeting, having agreement around how you're going to interact and work together is one of the key tools. And so we're going to model this tool in all 4 of our sessions. These are the agreements we came up with the last time. And I'm just going to kind of share a challenge with all of you. As you move to the 4th bullet, you're going to hear a lot today that every network is so unique. Every board is unique or steering committee is unique. But the promising practices allow us to really connect across the United States with the work that everyone is doing. And so the first group really was active in both the chat box and in star 2, which allows you to actually talk into the room. So the more you can share examples and the more you can share practices, the more we all walk away learning. So I just would ask you to consider participating at the level of your colleagues and see how that turns out for you. I'm not going to spend any more time on this other than to say really every time you convene a segment of your network, whether you're just forming or whether you have 6 months of traction or you're a more seasoned network rolling out a new business line or service, agreements of how you're going to work together are just really pivotal in gaining traction, success, and respect. So let's move on. Again, grab that assessment tool, and we're hopefully going to focus you on that tool and on what you can pull from one another around change. And if you would leave all multitasking, other multitasking aside, that will be terrific. So here we go. Let's step back and just for a moment, catch our breath and really focus on, so what is a healthcare network in a rural area? Just take a moment and read this from some networks that have existed or are participants in the NCHN Association. I'm not going to read this to you. As I said, I've asked you to really take a look at it, but let's hone in on some of the highlighted areas. When we look at change, it's as natural as the fact that our skin really kind of sheds sometimes. We probably, those of you who are practitioners, know the percentage of the cells literally that change in our body over 365 days. So change is a constant for us as individuals, as humans, and certainly when you bring together a collection of humans to form a unique network, change is inevitable. And so part of what those intrepid individuals claimed back in the 80s when they came together to form a network of collaboration and through the NCHN is they felt they were pioneering. So kind of hold that concept of a change leader as a pioneer, and let's think about why you're pioneers. As you go down to the highlighted kind of yellow text, you are literally bringing together competitors, most likely, to work in collaboration. You may just be a steering committee, you may be a grassroots organization, or you may be you may have incorporated for-profit, not-for-profit, some sort of legal formation. The truth of the matter is, though, that you are bringing unlikely collaborators together around a table on behalf of some vision and purpose that everyone can agree to and share. But that makes for often really wonderful conversations, sometimes conflict, and conflict, by the way, really was a feature, if you remember, of creativity and innovation from the last time we were together. Anytime you get together a group of individuals, competitors or collaborators, working together for some additional purpose, there will be change in the air. So we're just going to set that as our container. If you'll keep that in front of you, I won't ask how many of you have experienced that as being the definition of your world, but I hope that it will unfold as you share stories as we move forward. So this is just kind of a fun cartoon that Christy, who's one of my colleagues at NCHN, has pulled for us. And wouldn't it be nice if we could just point to all of our board members and steering committees and go, change? Sometimes we'd love to bring that home and ask for some of that at home too, but that's not how it works usually. So let's find out what are the reasons that change occurs or doesn't occur. And before we do that, I'm just going to have this slide here, but I'd like to ask you a question to engage you all in the chat box, if you don't mind. And I know there's so many of us, but I'm going to ask a question about how many members do you have in your steering committee or on your board? So just real quickly, type into the chat box, how many members do you have on your current steering committee or your network board? And the chat box accommodates all sorts of action. Perfect. You can begin to see the uniqueness, if we go back to the definition we just read a moment ago, of members. Everywhere from 15, great, 12, 8, 11, and it looks like Trish, you're holding the record for the other end of the continuum. So it looks like this continuum of who is on your board or who are the members of your steering committee in sheer numbers ranges from 5 to 15. I think I have that. Great. So it will be important as we share stories of change to realize that one of the unique features is how many folks are sitting around the table coming together to move through decision making. And I see Greg is coming in here. Greg, are you going to top everyone? That's okay. Perfect. Greg, it looks like you're kind of, our range here for board members is 5 to 15. No apologies needed. We're just delighted that you've all joined us. So let's go to this slide number 7 and say, when you consider change, what emerges? And I usually try and stay away from dense slides like this because it's a lot to read. But in this case, I'm going to take you down. If you don't mind, please read this at your own as you have time. But I just want to share with you the first bullet in particular, that change occurs at many levels in your network and in the communities you serve. So although there are anywhere from 5 to 15 current individuals around the table in your network, you have many other stakeholders. And as we continue to roll out the assessment, you'll begin to identify other key stakeholders, and that creates levels of interface and levels of change within the network. And then let's go down to the 4th bullet. Change varies in intensity. And we'll have a chance as we move through this conversation today to have you take a look at just who is on your board and how do you believe that they look at change. And it's going to probably vary around your table. And then the other element of change is that it's just really challenging to predict when a change will be fully implemented, but we've got a tool out here that we think will help you begin to put your arms around how long does change really take. So again, these are just some of the features of change. But before we move on, in our last session, Norma added another element of change that she thought was important. Does anyone have one additional element of change or two that you feel is important? Again, please use the chat box, or *2 will allow you to actually speak another change. Anything? Let's hold this as our second container then. It will work for us for the short term. And now we're going to actually move into the assessment. So grab your assessment. And the first question goes to the information that's really at the table when you convene your board member or your steering committee members together for meetings. The question here is yes, no, or maybe, and is think about your entire network. Your leadership or your board is identifying resources and discussing promising practices for building and sustaining your healthcare network. Yes, no, or maybe. The reason we're asking this question is twofold on the assessment. Is one, if you are the only individual bringing promising practices or opportunities, great. Thank you, Greg and Sue, for also sharing this on the chat box. That's so helpful. So wonderful. You're beginning to see again across the nation that 2 of the boards are truly engaged. They're bringing best practices into the table. Greg has a maybe, and it would be fun if we had time to unpack that. Sometimes maybe means that they're bringing ideas that may or may not fit with the culture that you're building around your network, or that they aren't used to being asked that. But I see some really healthy answers here in that there seems to be lots of engagement around what else could this network be doing, what can be learned from other parts of the country. Perfect. So capture that on your assessment, and then we'll move on. Although this quote comes from a long time ago, we just wanted to put out here that, you know, this whole concept of really looking at what is possible has been around for a long time. We've called it probably many different things. In this particular quote, there's nothing more difficult or perilous to conduct or more uncertain in its success than a new order of things. So again, this ties to and supports those of you who are leaders and pioneers in this work of bringing often competitors to a table to collaborate on increasing services, products, or just the general health of a community. And the community might be defined as a state. It might be combined as a geographic service area. Can have many definitions. So great work on this. So let's move to change. What's needed now? And this is the point where you can either, again, use the chat box. And Sue, Deborah, Kelly, Shantae, Mark, and Geraldine, thank you so much for using the box already. You're beginning to trump your colleagues in the beginning with how you're using that. I'd like to hear about one change effort that you have talked about, and you can just put that change effort in the box. Just one quick sentence about here's a change effort that we have attempted in our area, and was it successful, yes or no? So one change that you've attempted in your network, a successful, yes or no? Great, we've got a wonderful, several of you are typing in there. I don't mean to hold us up, but there's something so powerful about hearing from one another. Sue, great, kind of cross-regional, cross-agency assessment. So far, so good. I love that indicator. That's a perfect metric. Adding additional IT services. Woo, that takes strength, courage, and a good sense of humor. Well done, Mark. Great, we're going to get other additional ones that are going to come flowing in, and I'll brief them as we go through this process. I'll kind of tie them into our conversation. And what all of these are showing us is that these changes require not only your leadership, but the leadership, participation, and engagement of multiple stakeholders. So let's just capture a couple of them. And you're also beginning to see from these wonderful descriptions of all the varied and unique parties represented around a steering committee or board table. Can you begin to see the uniqueness of each one of your networks? Wonderful. So here's one, engaging family counseling in the county health department. Perfect, George. Developing a community-wide referral tool through building an IT platform that will accomplish this. Back to the drawing board. Not surprising. Agreement on IT, I think, is the last frontier right there after taking care of guilt. Let's see, let me page up here a little bit. Sharing staff, maybe. Wonderful. You can begin to see that there's a prognosis being shared here about here's an initiative, here's where we think it might land. That's perfect. Kelly's leading the effort to pull together multiple agencies doing things in common or sharing common goals. Wonderful. These are all very complex change initiatives with many different types of stakeholders or board members around a table. And I'd like to switch to a second question here. What do you believe, or what is the percentage of success of most change efforts? So let me repeat that again. What do you believe is the percentage of success for most change efforts? Just give us a percentage. How many do you think are successfully initiated and carried out? This one's always fun. Great. Tricia's leading the way. 25% are successful. 25. Great. Wonderful. I'm seeing the optimists here. Love it. I always err on this. 100% should be successful. Good, 50, 20, 30. Wonderful. Keep them coming in. The research shows us that of most change efforts that are initiated, there is a success rate of between 30 and 33%. And there are many, many reasons for that. And you all, through this grant and through the TA and through your leadership development, are really tackling three of the areas that really contribute to failure. And we are going to talk about failure in a moment because there's so much to be learned from failure. That really is a place where we succeed. But the research gives us some data that's helpful to know. And then more importantly than that, it gives us some data about why the success rate is nudging there about 30%. So let's talk about that a little bit more. Here's our first tool, and this is the first of two tools that we'll take a look at today. I'd like you to take one of your initiatives, and it could be the one that you mentioned and shared with all of us above. Take one of your initiatives and just kind of sit back in your seat, if you don't mind, and go, is this an initiative that requires transformation? In other words, if we look at the upper right-hand side, transformation, this initiative requires intensity, financial investment. It needs 100% of all stakeholders at the table involved. It's going to take my influence. I'm going to have to pull in the hospital association from the state. You kind of get the drift. Transformation requires really massive infusion of resources, time, effort, and influence. On the other hand, maybe your effort requires a tweak, and that's the upper left-hand side. But take an initiative and just mark it. And would anyone be willing to share an effort that's going to, again, just, I know we're shorting it, but in the chat box, would you be willing to share a sentence or two about an initiative that requires transformation? Better yet, if you'd love to press *2, you can join me in this conversation and share with your colleagues about an effort requiring transformation. Chat box is fine too. Great, I see a couple of people in there. And get ready, because in a moment I'm going to ask for an example of transition. Often in this work, we find with networks that they're usually involved, at least 2 to 5 of their initiatives are falling in one of these two areas. So let's hear about a change that's requiring transformation, and then once we have those on our docket and hear these stories, then we'll move to transition. Great. Michelle, thank you. Data sharing from all provider entities. I can only imagine that getting agreement around what data should be shared and how it should be shared, and the metric for sharing, not to mention firewalls and platforms, really does require transformation. If all of you, by the way, have not had a chance to read the latest newsletter that came out, CAP did a great job of having Tony Ann Richards share a beautiful case study around change in the most recent newsletter. And who would ever think that firewalls are an indicator of when transformation is needed? That was my interpretation, but it's a beautiful case study. Yes, Michelle is saying yes. Okay, Mark, sharing information with a great many community health providers. Just finding them and getting them together, figuring out if they're auditory learners or if they like to have information beforehand in charts and graphs, Mark. Great work indeed, transformation. Geraldine, patient and practitioner education, finding out where the baseline is. Beautiful. I would absolutely agree. These are beautiful examples and very powerful examples of taking on transformation. I see Deborah's got a note coming in here. Again, let me pause because I don't want to short the learning here at all. Would anyone like to press *# or *2 and share a specific example. Okay? You are making great use of this chat box, so this is perfect. Let's move now to transition, and please take a look at these. Deborah has a perfect one, peer-to-peer auditing. Oh, gosh, Deborah, good to you. Locating who the peers and having them agree of what should be audited on what time frame, and better yet, what should be reported, that really speaks to and commands transformation. So if you'll all join now in the chat box, those of you who have identified one initiative that requires transition, if you'll give an example. And maybe no one has anything in transition. Any transitions? Okay, if none, how about a tweak? One example of a tweak. Great, one example of a tweak coming up. Oh, more, good. While they're sharing their examples and promising practices with us, because that's exactly what you're hearing now. And as you see names associated with these change efforts, you might want to mark them down, because one of the items further on in this assessment is gathering best practices. So if any of you are doing patient and practitioner education, grab Geraldine's name, because you're going to want to connect with her. Good, Michelle, thank you. Training of staff, a tweak. And I'm going to make some assumptions here as Michelle shares this with us, that she's got some solid job descriptions in place, that this staff knows when performance evaluations and feedback are occurring, that folks know what their deliverables are and when they're needed. And fourth, that all of her staff have the most amazing sense of humor, because they're really engaged in some significant change. Well done. Great. So it looks like we have some tweaks and a bit of status quo here. Great. Hosting small table meetings to promote and gain trust among providers. Sue has given that great example, and I'm assuming, Sue, that might fall in the tweak bucket, but for all of you, anytime you convene a group together, whether it's your board or providers or supply chain managers, the opportunity for them to be able to talk to one another and share promising practices often turns out to be one of the most powerful product lines or service lines of your network. So Sue, well done. Shantae, great. You've got a tweaking of staffing changes. Perfect. So I'm going to read into your example that you've done a bit of piloting. You initially said, here's what we believe we need for staffing. You put it in place, or you thought about putting it in place, and then what happened when you went back into the assessment or reassessment, you were able to tweak. Perfect. That's a great example of tweaking. And also, by the way, Shantae, you might want to, I hope I'm saying your name properly. My deepest apologies if I'm not. But the other thing you might want to look at here, all of you, is that example that has been shared with us around tweaking could also be a value of transition. When you're willing to pilot something in, Shantae, thank you, perfect. The example Shantae gave us of tweaking could also be viewed as transition, because I'm reading into her story an example that she shared here, that piloting and the reexamination usually takes a bit of time. And so time and influence really tend to flow along this bottom line here. Perfect. These are great examples. So you'll see later on as we continue to discuss that for each one of your initiatives, for each one of your major goals for your network, use this tool. It's what we call quick and dirty. but it gives you a sense for each one of your tools, the level of intensity and the level of influence. And just a thought for all of you, if you have more than 5 initiatives that you're doing, and all of them are falling in transformation, you might want to do some calibration with your steering committee or board. Change is also, as you know, takes time. It is complex, even with a tweak, or even in status quo. And so too much in transformation, too much in transition means that your success might be a little frayed, might be more difficult. And remember, we're trying to move the bar for success from 30 to much higher because you're examining what contributes to success. Great. Let's move along and grab your assessment. I told you a moment ago, if you see names on here with these great examples of change and initiatives, to grab that name. Is your network building relationships with other networks, either you or members of your board? In large part, somewhat not at all. If you'll chart that, and here are some benchmarking opportunities that I've listed out for you, and there's probably many, many others, many other ways of getting benchmarking. And don't hesitate to get them from unorthodox venues. And I don't have a great example off the top of my head, but it doesn't always have to be from healthcare. And many of you are beginning to broaden who's at your table, and so that lends itself, as we talked the last time, to wonderful collaboration and innovation when you're able to do that. Wonderful. Oh, this group is great, Leslie. This is perfect. We're beginning to have some insight into what's happening across the whole United States. So this differs than our first group in that there's somewhat of an effort of benchmarking. This often, if you give your board members, and we'll talk about this more the next time we meet, or your steering committee members, a job description, often one of the easiest or the contribution that can come to the table is for every board member to bring in an idea of something that's being done in another part of the country. So there's an opportunity to build change over time. Perfect. That's great. Beth has a really interesting comment here that I just want to pause on. Somewhat within health systems, and as you think about, again, our need for innovation and creativity, she's really noted that her container at this point is pulling promising practices, but there's probably an opportunity to go outside and color outside the box, so to speak, and begin to get some promising practices from other industries. Thank you, Beth, for pointing that out to us. Great. So this completes, for your first round, question 5 on the assessment in this section. And now we're going to switch for just a little bit to you, the leader. We've talked about you as a pioneer. We've talked about you influencing this group of stakeholders ranging from 5 to 15. That is not insignificant. So for this moment, we'd like you to take one of the change initiatives, and it could be one, again, that you've already mentioned. And what was the change? What conditions contributed to the success? Outcomes? How did your board or steering committee respond? How did the community respond? And what did you as the leader contribute? So go ahead and fill that out. While you're doing this, one of the key takeaways from this slide and the next question is that you're building within your own network promising practices. You're beginning to kind of mine data from your own work of what works in your unique network. Good, and if anyone, it has been so terrific to have you share. So if anyone wants to put a change initiative in here and either describe how the board responded or what you, the leader, this is kind of a focus of this slide, what you, the leader, contributed, that would be great. What condition? It's the improvement over time. So thank you, Sue. If we flash back here to the grid that we've been working on, it sounds like her initiative falls into this quadrant. Again, you begin to see how these tools are beginning to tie together. You're going to take, again, for this slide, every one of your initiatives and assess it. And then you're going to want to take time to assess the change that was successful and gather information on why. Anyone else want to put a condition here about why your change was successful? Just one condition that contributed to success. Anyone else? Time is certainly a huge contributor to success. Thank you, Tim. Looking forward to your contribution. Build trust. And that too, in at least my experience, takes time to build, particularly when you're building trust among competitors. And don't let anyone tell you it's not possible. It absolutely is. Great. What's contributing? Or what did you contribute? Great. Provider needs are being identified. So allowing those impacted by an initiative to define what they need instead of someone or something being done on their behalf is always a sheer contributor to success. It absolutely, when those impacted define what they need, that really contributes. When change happens to us and we don't have an opportunity for input and to help shape it, very often our very natural reaction is to say, really, not today. Or, this is not good. Michelle, thank you. This is just perfect. Changes in leadership. George is talking about building non-competitive communities. That's an audacious and powerful goal, George. Good for you. Good for your committee. And sharing probable outcomes. Really knowing where you're going in change, not change just for the sake of change, is so important. So Kelly, you've just really created another key feature of change. Perfect. Let's skip then. Keep them coming, but we're going to skip to the next one. And in change, often though the research tells us we have a 30 to 33% chance of success, what happens is we really don't want to take a look at what causes the failure. And that's just such a mistake. Failures are one side of a coin of success. And so change in leadership, Michelle, I'm going to do a bit of reading into your language. But what could be an initiative that couldn't float could perhaps float with a change in leadership. When you start a network, the leaders that you have in place may be perfect. They may be just who and what you need for a focus on creating a new entity within a network, particularly if you, in George's case, are building a non-competitive community. And then as you begin to build initiatives, who you need at the table may in fact change, or the needs may grow. So the numbers that you have at the table, instead of 5, you may need 7. So take a moment right now and say, what's a change initiative that just flopped? I'm just going to use that word. What flopped? Why? What contributed to that outcome? How did the board respond? What happened in the community? And what did you contribute? Anytime we're leading, it's a time of learning. The two go hand in hand. So anyone feel brave enough to share a failure, just a sentence, and what was the outcome? Give you a chance here to kind of catch up. We're asking you to do a lot of this at the same time, and we really want to have the assessment tool completed. Great, we have a couple of people willing to share some failures or flops. And my hunch is that out of that came some key learnings, but I'll wait to hear them tell their stories. Great, please continue to fill this out for your assessment. Nice, Sue. You are probably in such great company. Putting a grant award before a need, looking for funding in all the right places and not having any place to land it. Perfect. That's a wonderful opportunity to learn about what is a community need and what funding might support that need. Powerful. Thank you so much. I know these are hard to put out there, and so I just really appreciate it. We need to bring these failures into the light because they really inform a growing body of change knowledge and gives us more and more information about how to build really powerful, engaged, nourishing, and beneficial changes. So any of you, what did you contribute? Great, here's another from Kelly. Implementation of technology that, we didn't have the support for. Great. And what about when the technology is implemented and the technology support becomes outdated? Many of you have probably dealt with that in your situations. Great. These are two very, very powerful and different examples around change. Probably if we had time to go around the table, the wealth of knowledge and promising practices from what doesn't work is very, very powerful and can be just a session in and of itself. We'll wait for Deborah to go ahead and do hers, but if you'll complete this form, what was successful and then what was a failure, that will give you a great part of that, this part of the assessment done. And let's move on to the next questions. What can you learn for your next pilot? When you have something that worked or didn't work, are you pulling that information forward and sharing it with your board members? So sharing what the outcome was for promising practices and spending some time on getting perspectives. Why didn't something move forward? Who could have shared more? If we go back to Sue's example, who might have shared more information about what the community needed before a grant was written? And I'm not saying, Sue, that's what it all happened, but are you sharing successes and what didn't go well with your group members, and how are they feeling about this assessment? So just kind of check this. It's healthy, by the way, to go back and do this on each one of your initiatives and just then take all of that information on each initiative and kind of rank it. But for right now, just take your general, this is where I think they land. And then what challenges does your network face and what advantages do you have? You pull these from what's working and what isn't working. Deborah just gives us such a great example here of a challenge in a network to this question number 7. Here's a group desiring to change care, but being unable to do so because it sounds like, Deborah, several different paths are being pursued simultaneously, so efforts are being a bit diffused. So one could take that example and Mark's next example of not understanding group needs. Both of these are very powerful examples of challenges that a group faces. and advantages of first seeking to understand what each group needs and knowing that what they need at the February board meeting might actually change because there are changes back home before the March board meeting. So always staying current with what's needed is probably one of your greatest leadership challenges and one of the greatest leadership challenges of your board or your steering committee. So the question here is what challenges do you face and what advantages? And you can just do a couple of notes here. And then what's important to begin to note here, and we'll go into it later in a much deeper way, key stakeholders. You can just write them down. It could be the mayor, it could be the Chamber of Commerce, it could be any entity that you haven't thought about. And this goes to the point that Beth made a while ago or earlier in our conversation about what might be knowledge from outside healthcare in particular. And we have some great examples here that are bubbling up. Network members who are not partners in charge but support the effort. So this whole area of no power goes to the conversation around influence. Great. That's a wonderful conundrum that you as a leader are often facing, and thank you, Beth, for putting that in there. We'll unpack it more when we get into our next session on board development or steering committee development. So our second tool asks you to think about, as I hinted to before, the second bullet here in particular, the number and intensity of change initiatives. Deborah did a great job of highlighting this. The intensity of change initiatives, if, for example, you have 3 or 4 of your board members looking at an initiative from 3 or 4 different lenses or pursuing an outcome in 3 or 4 initiatives, can be both great and detrimental. It can be great if you think about what we talked about from innovation and creativity, bringing new and original ideas to the table. But if there's not a pursuing of different paths with that particular thought in mind, bringing back new and original thinking, it really means that you're diffusing and you've increased the number of initiatives that are at your table. Also, too many, as we talked about, so you're stepping back in this second tool and you're looking at what's necessary to support the number of initiatives you have going on. What are the supporting structures that are needed? And that's really the key question here in this second tool, what's needed in order to support the number. This particular question, number 8, begins to get at the structure that's needed. Structure can have to do with understanding. So as you think about, and this question, by the way, can be looked at through each one of your change initiatives as well, or you can look at it from kind of a meta strategic viewpoint of, in general, does your membership agree and understand and are totally aligned with all of the changes and initiatives that you have in place during this contract year, yes or no? A structure that could be required here are continued discussions with very explicit benchmarks. I can't stress that enough. What are they desiring to do, and what are the metrics or measures for success? Again, as you look at your network from an overall perspective, is there all the topics have a total understanding or a lack of understanding? So again, the early adopters become very key in this question. Is there an understanding of what is needed to be done? And then what additional research would be beneficial? And that gets us back again to the topic we talked about last week, innovation and creativity through gathering best and promising practices, newsletters, blogs, good speakers, doing that through technology, Google Docs, Dropboxes, really capturing research for those members who really are reluctant to move without data or practices. And probably in your board, 1/3 of them will fall into this bucket of needing additional research before they're willing to commit or begin to agree to something. It's not totally true, but usually there are 1/3 of your members who will fall into this, really needing thoughtful data and or research. Okay. I want to respect your time, and I know I've moved us quickly through looking at the intensity of change. Second thing we've looked at is the number of initiatives you have, and then what are the resources that you have, including the understanding at your board or steering committee level. So this last question is a question for you. And it's a question of where are you going to observe or examine change over the next month? You've had some really, really thoughtful examples of initiatives, of change, of where there's been support, of where there's been some failure and why in the chat box today. The participation has really been so thoughtful. Take a moment and identify here 1 or 2 areas that you're going to just agree to observe or to examine. And the level of intensity, I'd encourage you to choose one area that calls for transformation and another area that calls for a tweak. So this is what you, a leader, are going to gather for looking at change and looking at it through the lens of kind of probably 1 or 2 different levels of intensity. And you can take this tool, by the way, and all of these tools actually, if we start back while you're completing that, let me just add 2 more thoughts here. And Mark, please continue with the example you were going to share. I just want to go back here and remind you of this grid. If you're beginning to think about or doing a kind of a mid-evaluation of an initiative, it's really interesting to have your board, each individual member, perhaps when you're out visiting them or together around the table, each one of them begin to look at each initiative that they have agreed to and identify which quadrant it might fit in. This is a really powerful tool for you to gain some insight into how they're thinking at this point in time, remembering that opinions and perspectives can change, but it begins to give you some data about how they're viewing initiatives. So this is a really powerful tool for developing a movement. Mark, I'm really going to guess, perhaps, and I may be guessing incorrectly, that one change you're going to look at and keep your eye on and just observe is what is the group effort. So moving as I'm hearing this and interpreting it, you're going to observe what does it take to move from individual efforts to group efforts. Let me kind of move us ahead. Sorry if anybody gets seasick with moving this, but you're beginning to watch for your change, moving individual to group efforts. Kelly is going to begin to observe and just watch. So you can do this so easily, bringing topics to the